Real? When Tabitha Babcock brought home her Newfoundland puppy, Cerulean, she thought she was starting a new chapter.
The color blue. It was my favorite Crayola crayon when I was little.
But just a week later, everything changed.
He was really sick and he had to go to the ER and basically was set on blood transfusions and glucose strips, and it was really sad and life-threatening. And
The emergency visit came with a steep price tag, about $4,000. And at just 9 weeks old, Babcock says she was forced into a heartbreaking decision. She signed a do not resuscitate order.
With my DNR, I signed it because it was like as much as my savings as I had. And I was like, I just can't, especially when like there was no hope really.
She says the vet didn't expect him to survive the night.
Dug a little grave for him in my backyard and just laid on the floor with him and was like, buddy, can you please like fight as hard as you can?
And Cerulean did. Now 7 years old and weighing about 150 pounds, Cerulean is still by her side, a calm, gentle giant.
It was such a miracle. So that was how we started our journey together. Little trauma bonding.
After weeks of treatment, antibiotics, and follow-up care, he slowly recovered, but the financial impact lingered.
We lost that whole cushion, so then it was like everything else we had to buy, continuing on for those multiple months, whether that be medication or special food, was a stressor, like for me, for sure. It probably took a year to feel comfortable in life again.
An analysis of federal inflation data shows prices for veterinary services have jumped about 40% since 2021. That's faster than overall inflation during the same period. And dog owners in San Diego spent about 38% more on vet care than the national average, about $1,100 a year. The price increases are especially notable for preventative care. In 2021, dog dental cleanings in San Diego were estimated around $320. Now, the cost is estimated at closer to $700, and that's before any extractions or additional treatment.
It's a big worry that I think of quite often, and we try to do a lot of like preventative health, even for his teeth, but I do know he'll probably need some help and it'll be a big chunk of change.
For Babcock, those costs don't end at the vet office. Food, supplements, and preventative care can add up to about $375 every couple of months.
We used to do raw diet. That has absolutely gone up, so we absolutely do not do that anymore right now.
Pet insurance is one option for dog owners to offset unexpected medical bills, but monthly premiums can range from about $30 to more than $150 per month, depending on the dog's age, breed, and coverage limits. Cerulean has a pre-existing condition. Babcock says it makes finding useful insurance coverage more complicated.
I had, all the comparison charts, all the insurances, what would work best. And so ultimately, it wasn't going to help me at that point.
Now, as Cerulean gets older, she's reconsidering it.
We've paid out of pocket since then. He's not had any major health issues, so we're just, praying and hoping that it continues that way.
Across San Diego County, dog owners say they are feeling similar pressure as the cost of living rises. Some say they delay or decline care because of cost. Others say they cut spending elsewhere just to keep up with pet expenses. For Babcock, the rising cost of caring for Cerulean has also forced bigger questions.
I think a big worry is like, would I have to move in order to like afford just like a comfortable lifestyle, because it is so high, like in San Diego.
Still, she says the bond she shares with Cerulean makes the financial strain worth it.
He brings me a ton of comfort, a ton of peace. I'd sell all my furniture before. He's not going to be taken care of.
Heidi de Marco, KPBS News.